Hi, welcome to EliteMedicNexus, your medical learning hub where complex concepts become simple, visual, and clinically relevant. Today we're diving into the heart, the engine of the body. If you understand blood flow through the heart, cardiology suddenly becomes easy and intuitive. By the end of this video, you'll be able to identify all the chambers, valves, and major vessels of the heart, describe the step-by-step pathway of blood through the heart, understand how structure supports function. Remember a few quick exam tips that many students often miss. Let's get started. First, let's look at the heart's anatomy. The heart has four chambers: the right atrium, right ventricle, left atrium, and left ventricle. The atria are on top, think of them as the receiving rooms, and the ventricles are below, the pumping chambers. Now the heart has four valves to prevent blood from flowing backward. Tricuspid valve, between the right atrium and right ventricle. Pulmonary valve, from the right ventricle to the pulmonary artery. Mitral, bicuspid valve, between the left atrium and left ventricle. Aortic valve, from the left ventricle to the aorta. Remember this simple tip: tricuspid has 3 letters, 3 leaflets. Mitral equals 2 leaflets. The right side of the heart handles deoxygenated blood returning from the body, and the left side handles oxygenated blood coming from the lungs. Notice how the left ventricle is thicker. We'll explain why in the physiology section. Let's follow the blood through the heart step by step. Deoxygenated blood enters the right atrium from the superior and inferior vena cava. It flows through the tricuspid valve into the right ventricle. When the right ventricle contracts, blood passes through the pulmonary valve into the pulmonary artery, heading to the lungs. In the lungs, blood picks up oxygen and gets rid of carbon dioxide. Oxygenated blood returns to the left atrium via the pulmonary veins. Blood flows through the mitral valve into the left ventricle. The left ventricle contracts, pushing blood through the aortic valve into the aorta, which distributes it to the entire body. Quick exam tip: always remember the sequence: RA, RV, lungs, LA, LV, body. A mnemonic I use is right room, right pump, lungs, left room, left pump, life. Notice how the valves only open one way, ensuring blood moves forward efficiently. This simple design prevents backflow and supports effective circulation. Now let's connect structure to function. The left ventricle has the thickest wall because it pumps blood to the whole body, while the right ventricle only pumps to the lungs, a short distance. The heart works as a pump using electrical signals, but today, focus on the mechanical aspect. Contraction of ventricles pushes blood out. Relaxation allows filling. Simple but vital. Quick biochemistry note: the heart muscles need energy to keep pumping. They use ATP generated from oxygen-rich blood. This is why oxygen supply is critical. If the heart is starved of oxygen, even briefly, function is compromised. Something to always remember for exams and clinical practice. Many students mix up the right and left sides or confuse valve names. Here's a quick fix: right equals tricuspid, left equals mitral. Remember RA, RV, lungs, LA, LV, body. Also, don't forget, valves only allow forward flow, and the left ventricle is thicker. Always a common exam question. That wraps up week 1 of our cardiovascular series. Today we covered the heart anatomy, blood flow, and basic physiology, plus a little biochemistry insight. Next video, we'll dive into hypertension, pathophysiology, where we'll connect anatomy and physiology to disease. So stay tuned. If this video helped you, subscribe and turn on notifications for EliteMedicNexus, your guide to mastering medicine step by step.